Your experience. So you
Yeah,
had denture for like 30, 40 years.
yeah. It was so embarrassing before because I
Uh-huh.
had this denture for so many years,
Uh-huh.
and in my country and especially in my community,
Right.
living, wearing dentures is just like normal. It's a normal thing to you because even your teacher, your parents, your even the dentist, wearing dentures until I went to college, and then I realized, oh, so embarrassing. But then, yeah, what can I do? I just have to live with it, right? Until I came here, and I felt so um, not confident, wearing dentures until I found this place, the Center for Implant Dentistry, and yeah, they gave me hope. And
So
yeah,
remember you
I
came
really
in
did.
2019.
Yeah, I came here 2019, and during that time, the technology was not that advanced, should I say that? And I was not accommodated because of course, the technology. And then I called, I think a month ago, asking for dentures. And then I was asked to come back. And yeah, they said that I could fix they could give me an implant. And yeah, as you can see, I have this implant. And I feel so great, amazing that I have this new teeth, new chapter of my life wearing this. Yeah, I feel great, and I'm thankful for Doctor Doctor Sam. I really can't pronounce your name, Jane, Doctor Jane, and that, yeah, I'm so thankful that yeah. What can I say? I'm so happy,
So in
and
2019 when you came and we took your CT scan,
mm-hmm.
we found that the denture had destroyed so much
Yeah,
bone,
no
there was
bone.
no bone left.
Yeah.
So at the time, we did not have the confidence and knowledge
Mm-hmm.
that we could treat a difficult case like yours
Mm-hmm.
unless we did those zygomatic implants which go
Yeah.
into your cheekbone,
Yeah, I remember that term. I've been
Right.
researching that, and I
The
was
zygomatic
so
implants, right?
scared. What
Yeah.
what was that? Yeah, but yeah, day by day, I've been thinking. I felt so embarrassed, and when I look back, and what did I do to myself? But I cannot blame my parents, because lack of knowledge also.
So
And
when you called after 5 years and you called me like, can we at least make you better fitting dentures, right? That's what you called for, right?
yeah, and
So
I was surprised that you said, "Oh, we have this." You come back, and yeah,
right.
I really, and when you told me that, I told my husband, maybe they would just tell me, "Oh, it's the same thing that I don't have any bone and it cannot be fixed."
Right, right,
So
right.
I was not expecting that you would accommodate me and you would
Yeah.
tell me that it can be done.
Yeah.
So
So
I
when
was
you called,
surprised.
I went and looked at your CT scan from 2019.
Mm-hmm.
And with today's knowledge and surgical skills that we have developed, right, we said, oh, we can do this case. Okay, so cases like yours where there's absolutely no bone left, we do these cases routinely now.
Mm-hmm.
So what we did in your case, we placed very thin implants,
Yeah.
10 of them in your upper jaw,
Mm.
and we did sinus lift,
Mm.
okay, and we did very special procedures,
It,
but it was done in one surgery,
yeah.
and you got your teeth in like 3 days.
Yeah. And you mentioned about that grafting, right?
Yeah, we
Bone
did
graft,
a lot of grafting.
bone
Yeah,
grafting.
yeah,
And I was so reluctant, and my husband told me, really, because we have trouble coming up. My sisters are
yeah.
here,
Right,
and they were
right.
surprised that I have this,
Yeah.
and they said, "Oh, you look nice." Yeah. Uh, I I really can't believe that I did this.
Yeah,
You did this.
yeah, yeah.
And I thank God, of course.
Yeah, no, I was keeping my fingers crossed that this was one of the most difficult cases that we have done but since we have done many cases like this before, uh, less difficult than yours. So we had gathered confidence throughout the years that okay, this thing works. So we'd applied the same treatment style, and we did it. And I'm keeping you under my observation, having you come every 2 weeks, right?
Yeah.
So everything looks great, you know. So it further boosts our confidence that we can take care of these cases. So the biggest thing what we did is that we gave you implants where they belong, in the mouth, on the ridge of your jaw. We did not go and put your implants in the cheekbones and all that, right?
Yeah.
So you have 10 implants where they're supposed to go, and you have a fixed bridge, and you don't have to remove your teeth anymore,
Yeah.
and you can feel your palate,
Yeah, that's
which you did not feel
strange.
for 45
That's
years, right?
not 30,
30 years.
years.
Yeah.
That's strange. My normal routine is to brush my teeth, and then after brushing this lower part, my next step is to
To take it out.
why am I touching this? I told my husband,
Right.
it's strange, and it's a great feeling that I have new teeth, and
Yeah.
I'm I feel like my life is better or best. I mean,
Right.
I'm so blessed that this happened, and I'm so thankful to you, Dr. Jane, and to
So you see, we did not engage you for like 1 year to finish your job. We finished your job in just 4 days.
yeah, I really can't believe. And my husband
Yeah.
was telling me, because I was so reluctant at first,
Right.
because I was thinking that maybe you reject me, and I was so scared because the last time you saw me in 2019, and you explained to me, it's not just you who saw me. I think one more surgeon told me that I'm sorry. He said I'm sorry. It can't be done. So I really didn't think that it will.
Yeah. You
It
see, we
will.
are an implant center. We only do implants. It's me and my wife, the two implant surgeons here. So, because of doing this kind of job for so many years and on a full-time basis, and we also have like machines here in the back where we manufacture the teeth.
Yeah, that's one thing also
So
that
because
you.
of that, we were able to manufacture your final teeth right
Yeah,
after surgery.
yeah. I was thinking that if I would do it to another place, they would just refer me to another place,
Right.
come back and then come back. So I don't want to do that. Yeah,
Yeah.
and I'm really thankful that I found this a place, and yeah, thank you.
We are going for a class, one more class. We gain new surgical skills by going to the lectures of different surgeons all over the world. Different surgeons have different approaches, right? So this is how we have gathered our knowledge by learning from other experienced surgeons. So we are going to Las Vegas in December. It's a 3-day class to deal with the problem in the lower jaw, because in the lower jaw there's a nerve. So we are going to take a class where we reposition the nerve so we can place the implants, even if there is not much bone left there.
Wow.
So this is our next endeavor.
When is
So,
that? Where is that? Where?
So there is a professor coming from Europe.
Oh wow.
Yeah, so his life and his main practice is doing implants in the lower back, where patient worn dentures for 30 years and no bone left.
Wow.
And because there is a nerve in the way, so you cannot place the implants.
Yeah.
So until now, we have not been able to place implants in the back if the patient had worn dentures for 30 years. But with this new surgical technique, we'll be able to do that. So learning is lifelong, right? So we are very passionate about what we do. So our treatment is biologically robust and mechanically robust, and it is well thought and it's swift. Okay, so the big thing is like the treatment at our implant center does not linger on for 6 to 8 months to 1 year and all this stuff, right? The treatment is finished in 3-4 days and you move on with your life. Yeah. So like the treatment you don't have to give me 1 year of your life, you know, to finish this project, right? We want to finish the treatment so you can move on and enjoy your life.
Yeah.
Yeah. No, thank you so much for coming from Daly City. And if you have any more patients who have dentures for 30, 40 years, you know, and everybody has said no about nothing can be done,
Yeah.
we can treat that patient for you
Oh,
for
will
here.
do.
Yeah.
We'll sure do that. I will
Okay.
refer.
Okay, thank you
Yeah.
so
Thank you
much.
so much too.
Thank you.